pediatric psychology team is a very passionate group. We're very passionate about advocacy for our patients and within our clinical programs, making sure that we're getting patients and providers access to the resources that they need, both within our system and across the state.
Our pediatric psychologists typically have their own clinics where they see patients for assessments or therapy for various types of problems. But we also work in those other clinics around the hospital. So our goal in those clinics is to help identify children who have both a chronic illness as well as some type of behavioral or psychological issue that could benefit from an intervention.
Most patients and families aren't at their best moments when we're going into the room, so we're there to ask the hard questions. We're there to help address the big emotions and help families process that information in a way that when they leave, they know what the next steps are. And feedback from families has been that they didn't know they were going to meet with a psychologist that day, but that it was really helpful. And I think that it's an innovative way for us to have an opportunity to help destigmatize seeking mental health care.
We know that children who have chronic medical conditions are at higher risk for also having psychological, behavioral, emotional issues. We need to treat the whole child. We're not just treating a physical health issue in most cases, but we're also treating the psychological and emotional sequelae that are often associated with the disorders that the children have.
One of the great things about Arkansas Children's is that there's so much intention on the collaborative nature for all of the things that we're doing. They have a huge behavioral health initiative. Patients will have access to any behavioral health resources that they need and any touch point while they're here, and us being able to be a part of that team is really exciting.
I think what's particularly notable and deserving of recognition is that psychology is infused in or disseminated across all clinics and kind of always present, but not necessarily recognized as a member of so many clinics. An award like this sort of raises to the level of recognition of just how integral they are to so many teams.
Pediatric psychology is spread out, and it does take intention to have teamwork. Even though we are all in different areas, the support for one another as well as our teams is really one of our key values.
We've had a group of pediatric psychologists here working in over 30 different clinics, and they work very hard in a collaborative way with the medical teams at ACH, and receiving the award provides recognition that the work they're doing is valued.